Welcome, Ati. I'm so glad to have you on the She Doesn't Settle podcast, and really thrilled that our listeners get to hear your story. Um, in true fashion, I'd love to have you start by sharing a little bit about who you were at the beginning of all of this and what led you to what you're doing now.
Sure, it's my pleasure to be here, Kelly. Thanks for having me. So my name is Ati Hakimi. I am actually of Iranian American descent. Came to this country when I was 2 and never went back except for once. And I'm very proud of being bicultural as well. And I think that's where a lot of my tenacity came from, is that technically I'm an immigrant to a beautiful country. And I didn't feel like I had any limits. And that was the whole reason we came here, was because this is the land of opportunity,
Yeah.
right? So originally from California, moved to Vegas about 9 years ago. And my story is that I'm a physician. I'm a family medicine physician, and I've trained at Northwestern. I actually did something else. I did a little fellowship in geriatrics, which means seniors are my jam.
Uh-huh.
And I decided to come to Las Vegas 9 years ago, basically to try to make a difference, right? Because as you know, unfortunately, our city is number 40. Well, our state is number 47 in the nation in healthcare. And one of my colleagues reached out and said, "Hey, we don't have enough doctors. Can you come out and help?" He was a colleague from an MBA school that I also had done. And that was it. Came out here, never left, love it. Still trying to make a difference.
Yeah, I love that. What was it like? I mean, you were so young when you moved here, but was there an adjustment period? You mentioned tenacity, right? As a young girl, what was that journey for you?
Yeah, so I was only 2, so I didn't know any better, honestly.
Yeah,
But when we moved to the US, my dad was an entrepreneur, so he always, saw a lot of opportunities, and we actually went into the restaurant business. So I've been working since I was 8 years old in restaurants. That's how I learned how to be a little bit social, work with different types of people, different cultures, ethnicities, and just personalities in
yeah.
general, right? So it was a good fit to go into family medicine for me from there. But one of the restaurants that we owned was actually a Mexican restaurant. It was fabulous. I loved it to death. That's why it's one of my favorite foods, even though I'm Iranian. Um, but I speak Spanish fluently because of that now. So I'm
Wow,
actually trilingual.
that's
So
amazing.
I think that's kind of what I mean, is like I've always been in a world of knowing the value of hard work and the rewards that can happen, knowing the value of money
Mhm.
at a very young age, knowing how to respect it so it respects you back, those
Yeah.
kinds of lessons. And it was kind of solidified with my MBA education as well.
What inspired you to become a doctor? Did you have that thought at a young age? Did it happen later?
Yeah, so I mean, I was the little girl that was playing with Barbies, but I wasn't like dressing them up. I was bandaging them.
Ah,
So that was kind of like, there was just kind of that predisposition almost. So my
yeah.
last name is Hakimi.
Yep.
So in Arabic, a Hakim is technically a physician. So my grandfather was a physician as well. So technically my name means doctor, doctor. So call
Interesting.
it predestination, whatever. But yeah,
Yeah.
it's what I've
Okay.
known. Yeah.
Yeah. So you focused on geriatric care and then you moved to Vegas. Did you also work in geriatric care for a while when you came here?
Yeah, so when I moved to Las Vegas, I joined this large group called Healthcare Partners, and I actually was working in what's called the post-acute. So post-acute is that in-between stage when people go to the hospital, they're not quite well enough to go home. So
Mhm.
they get what's called therapy, physical therapy, occupational therapy, things of that avail to make sure they're safe to go home. And so, most of medicine honestly is geriatrics nowadays anyway. So that was my position. And it was a really good fit for me. I really loved it. And I think that I just wasn't in the right place to do what I loved, which kind of led me to where I am now.
Meaning environment, like, yeah.
Yeah, so I mean, unfortunately, Kelly, our the system of medicine or health that we practice is not really health care, it's sick care,
Yep.
right? And so the other problem with that is that as a physician, especially a primary care physician, we were taught a lot about prevention. And the current method that we have with sick care is that my 14 years of education has to be translated into a 10-minute visit.
Yep.
That doesn't work,
No.
right? Um, the system that we have is unfortunately more focused on the bottom line. When I get that, right? Like I said, I got an MBA. I've been working since I was 8. I get that. But
Yeah.
at the expense of human lives, not for me.
Mm-mm.
Not for me, right? And I'm blessed and grateful to say that I'm in a place in my life where it doesn't really have to be about that, to tell you the truth.
Yeah.
Um, it has to be about making a difference. That's what I was put on this earth to do, and that's kind of my objective, is to do that before I leave this earth. And so I started my own practice.
Mm-hmm. I love it. And
Mm.
how many years has it been now?
So I actually started my practice in June of 19,
Okay.
and COVID hit
Yep.
March of 20.
Yeah, that's what I thought.
Yeah.
Because I remember speaking to you, I think right, it was right at the time you were starting.
Yeah. Yeah.
Um, so talk about that, because obviously going out on your own is scary, but you were
Yeah.
frustrated with your inability to connect with your patients and give them the care that you feel they deserve.
Right.
What did that look like for you?
Um, so it looked like I was done with medicine because I was just so disheartened. And, there's this horrible word out there called physician burnout. So the secret is that we are not burned out. Physicians were not made, we were chosen, right? Little girl playing with dolls and putting band-aids on them. Like, what kind of nonsense is that? Right. So I truly believe that. Um, but we are put in positions that do not nurture us, our healing abilities, our education, um, our value to this entire healthcare system, right? That was reflected too when we went through this pandemic, where it was completely politicized,
Yep.
right?
Yep.
So that was just a reaffirmation of our sick care system that we have in this country. And I think for me, I was done. I was so disheartened. I was so frustrated. Um, all of the questions about why did I do this? But could I start over? Because, honestly, at that time I was 46, around there.
Mhm.
And I'd already been practicing medicine for almost 20 years,
Wow.
right?
Yeah.
So to think of starting over was very daunting. But remember, I came from a pretty tenacious environment of, being pretty um, vocal and standing up for myself and things of that avail. So I wasn't afraid of hard work, right? I was just a little concerned about having a consistent paycheck, honestly, because
Yeah.
we have about $350,000 worth of debt when we come out of school. It's literally a mortgage. It's a mortgage.
That's
So
how
I
much
need
it
to pay
is?
at least. So that's for primary care. Now, if you specialize, it's even more because there's more schooling involved. So that's the other problem. People think, wow, doctors make so much money when they come
Right.
out. So, but if you think about that opportunity cost that we've lost by being in school for so long, it
Yeah.
really kind of balances out in the end,
Yeah.
right? And if you think about how much we make versus our athletes, right?
Yeah.
We save lives.
Yeah.
Okay. So
So skewed.
that's really something that people have to take a step back and understand, right? But we do it at a cost too. We
Mhm.
give up our lives in terms of our families, our um ability to enjoy our quality of life as well. I mean, it's like I said, I feel like we were chosen, we weren't made. It's tough. It's a tough environment. It's very
Yeah,
challenging. It's very stressful. You know, all the words that we tell you not to do, we did to get to where we are. So a
exactly.
lot of sacrifice, right?
And
A
at that
lot of
time,
sacrifice.
were you kind of regretting that you came from California to Vegas? Is there a vast difference between care even within those two states?
Yeah, so that's an excellent question. I think every state is different because I
Yeah,
also trained in Illinois, right?
yeah,
I did some locum tenens, which is like temporary work in Arizona. And even California in itself has, it's almost like its own state within the cities too. I mean, the North versus the South, they're just completely different cultures. So it is different. It's definitely different. The thing that I do like about Las Vegas, honestly, is the fact that I was able to start my own practice
yeah.
because there are other states. Well, that's starting to go away too. That might be a whole nother podcast you need to bring me back for, because it's I'm actively going through that right now. But I was able to start my own practice in other states. It has become so monopolized by these large corporations in terms of HMOs, hospitals. You know, physicians aren't even allowed to own hospitals because of these stark laws that, you know, there'll be conflict of interest and things of that avail. It makes no sense. Makes no sense to me. We are the people that should have these things because we know what we're doing in that environment, right?
Yeah.
Um, but yeah, so Las Vegas was a better fit for me,
Okay.
luckily, to do my own thing because that was still um a possibility
Yeah.
instead of being employed.
Yeah.
So it kind of worked out in the end.
So you just jumped right in. Did
Yeah.
you try to like create the business before leaving, or did you just quit
Yes.
cold turkey and you went
Yeah.
to the
So remember, I was doing post acute,
yeah.
which means I didn't even have any outpatient patients really.
Okay.
And so the concept that I was drawn towards is a concept called direct primary care. It is a concept that has been developed throughout the nation by physicians because, listen, we didn't go to billing school, we didn't go to coding school, we went to medical school, right? And so the concept is having a direct relationship with our people. In my practice, super tiny, it's just me, myself, and I can do
Yep.
my own blood pressures. I don't need anybody to do that for me,
Yeah.
right? And so it's a direct relationship. And then it's like Netflix. You pay us once a month, we're there for you, right?
Mhm.
And so you can call, you can text, you can email. I even do house calls because I have, you know, my seniors that still need me. And I even go to a few facilities in town, like assisted living and things like that for my seniors. So it's about being available. It's about being accessible. It's about doing what we know how to do best. And honestly, during COVID, we really made a difference because we kept everybody out of that hospital
Yeah.
so that they didn't actually get COVID because that's where it lived, right?
Yes.
And I actually had a guy that had, you know, no insurance. So he got COVID really bad, got super sick. And everybody's like, send him to the hospital. And I'm like, he will go bankrupt. And we didn't even have like evidence-based medicine yet about what to do for it. It
Yeah.
was all like hit and miss kind of stuff. And he'd get charged for all of that. So we literally did this every day. That's the only good thing about COVID is telemedicine really like became accepted, even though I was doing it before then. And his home was the hospital. So we sat, we chatted. I sent him a blood pressure cuff, a pulse ox. He had a thermometer, whatever medications I could actually get the pharmacies to give to him because they were, you know, they were all trying to help out as well. I mean, and to make a long story short, he was very sick. He was very sick and he's fine now.
Yeah.
How much did that cost him? Maybe $300.
Yeah. Versus going in the hospital and going into debt.
Thousands. Just
Yeah.
walking in, you're going to pay 5,000. You know,
Right.
that same bag of IV fluids that we throw on to everybody just, you know, for fun. Most people are dehydrated. They will charge you $500 in the hospital environment. It's $150. Yeah. So that's the game that's played, right? And that is because insurance and other facilities, in terms of hospitals, clinicians, imaging centers, labs, they're always fighting these guys. We're always fighting. And I don't want to fight anymore. I just want to be a doctor. I've
Yeah.
literally had a 5-cent check mailed to me for my services. It's not us, it's the system. So people have to understand, my God, my doctor this, my doctor that. You have to understand it's the system.
Yeah.
It's so broken. It doesn't allow us to practice the art that we have been taught. And so a lot of my colleagues, unfortunately, because they do procedures, things like that, they can't do necessarily this, but they're trying. They're starting to become direct primary care specialists in terms of cardiologists, dermatologists, things like that.
Okay.
Because they want to be able to give good care as well. And this is really a good way for them to do it. Listen, healthcare is not expensive. Hands in the pot trying to tap into it and telling us what to do is what makes it expensive. I can do an entire set of labs, and I've told you this personally, for $40
Yep.
out the door, right? Because I take the onus and I pay the lab. So they don't have to go running around and looking for copays and deductibles and pre-authorizations and all these words that have nothing to do with healthcare, right?
Yep.
I've talked to an imaging center. I said, hey guys, how much will you charge me for an x-ray? $25, a CAT scan, $200, an MRI, $300
Well,
tomorrow.
I've noticed because I own my own business and I don't have the best insurance because we're very limited.
Insurance doesn't take care of you. We do.
No.
Yeah.
So, but I've noticed that now that I pay cash for most of that stuff, and the difference, how quickly you get it, and it's cheaper if you pay
Yeah.
cash.
Cash is king. You've known that all your life.
It's
Nothing
just,
has changed.
it's wild.
Nothing had changed. Nobody wants to deal with that. Nobody wants to deal with the coding, the billing, the nonsense. That's them. That's their world. That's what they've created. Now, the sad part is that I actually go talk to, the family residents in town with the whole 2 programs that we have or whatever. So, and I asked them, I was like, hey, do you guys know how to bill and code?
No.
20 years later, same story. It's almost like the system is set up for us to fail,
Yeah.
to be very honest.
Is there any place in the country that is doing it well?
In the United States?
Yeah.
No,
No.
no.
Is
It's
there
all the
a
same.
country
If
that,
anything, it's getting worse. In the US, it's getting worse. It's
right?
completely becoming monopolized. So there is one a very large healthcare system that rhymes with mighted, right? That has completely monopolized
Yep.
the entire system. The CEO walks away with, I think last year, I don't know, 20, 30 million. And of course, they're not a physician. They have nothing to do with it,
No.
but it's humbling because you're the persons that are telling me what to do, what to order, what I can and can't do. Have you ever told a patient they have cancer? Have you ever told a patient they have 6 months to live?
Yeah, and you're getting 10 minutes for that.
Yeah. So that's why I was like, I
Yeah.
can't do this, not for me. And I really, I commend my colleagues that do. And then when they do, when they get frustrated, physicians have a very high rate of suicide.
Yes.
It's very hush hush. It's very hush hush because it makes the institutions look bad.
Yeah.
It's a very high rate, especially in our kids, like in our med students, our residents, things like that. They get pushed, they get told what to do, they get bullied by the system. And they're still kids.
Yeah.
So they don't know what to do. So they commit suicide, and it's very hush hush. But it's a very, very unhealthy system, ironically enough. It's
Yeah.
very harmful for us as well, too. So some people have tried to work around it and or retire early and or leave. Would I do it again? Yeah.
Hmm.
But I would have started my own practice right away, to tell you
Yeah.
the truth. everything happens for a reason. There's a lot of lessons that I've learned along the way, and I'm grateful and blessed for all of that. But there's a lot of it I didn't want to learn.
Right. When you made that transition, obviously you were under a lot of stress, probably not quite healthy yourself,
Yeah.
whether it was mentally or physically. When you started your own business and got things going, did you see that shift within yourself as
Oh,
well?
for sure. Yeah. So what I did was I actually left. I quit that toxic, environment that I was in. And I was in a post acute, so it was a little different. Uh I had to take care of, pretty sick people because the culture that we have now is the hospital is the last place you want to be. Once upon a
Yeah.
time it was the place to go to if you were unwell. It's the last place you want to be. So they push people out sooner because the insurance won't pay for them to stay any longer. So they push them out sooner and they're still sick. So they come to me. So
Mhm.
I was literally the cardiologist, the infectious disease doctor, the pulmonologist, the everybody, because I had nobody. Like, so a post acute is literally a nursing home.
Yeah.
And I have nursing home staff telling them what to do. Right. So it was tough. And then I think the straw that broke the camel's back for me was the metrics that were brought in. So you guys don't realize this, but there are so many metrics that dictate our pay. So in the primary care setting, if my blood pressures aren't so and so, if my blood sugars aren't so and so, if my cholesterol isn't so and so, I don't get paid. The
Really?
onus is on us. Yes. Yes. So that's the primary care setting. So in my setting, it was about customer service, about how many days I could keep them out of the hospital and not get them to go back. That's what my pay was about.
And so if
So,
it was too long, you got less money. I mean, too short,
well, I
they
didn't get
returned
my
too quickly.
bonus, which
Yeah.
was literally my pay
Yeah.
that they were holding on to with these metrics. I think for me, it was also this customer service word. Um,
Mm.
I physicians aren't I don't do customer service. I'm a very nice person, but I am an educator. I am a healer. I am a health advocate. I am a health coach.
Yep.
I don't do customer service, right? I'm not trying to sell you a product. I'm not trying to convince you of buying something. So that didn't work for me. So, ironically enough, I would get written up because
Yeah.
I would tell people, no, I'm not
Mm.
giving you narcotics. I'm not doing excess imaging. I'm not giving you extra medications. No,
Right.
she's a terrible doctor.
Yeah.
And so, because I was a little bit older by the time I started these metrics, I understood that this was not for me because this isn't what I wanted to do. But as a younger doctor with those metrics, I internalized it. And I was like, man, I really suck.
Yeah.
My patients are getting sicker. I suck. I took all of that blame. I took all of the onus when it wasn't me. You
Well, and then
have to
you
do it.
lose your focus on why you're there to begin with because you're focusing so much on these numbers, and that's the distraction
Meeting
from what you're.
metrics, right?
Yeah.
Yeah. Yeah. Yeah. Yeah. And I'm younger too. I don't have that experience of life and how it works and that I'm a resource. I
Yeah.
can't force people to do anything. I mean, you know that.
No, you can give them the tools and the information, but it's on them at the
They
end of
don't
the
teach you
day.
that in medical school either.
No. God. Okay,
They
so
should, but they don't. Yeah.
life is different for you now. You
So
have no
now
metrics other
uh-huh.
than your
Yeah,
own.
so that's what broke my back was I was done with that. I left, I quit. And then there was this thing called Leadership Las Vegas
Mhm.
that I joined, which was a group of individuals from all walks of life in this city that were the top in their field, professionals. The
Yep.
quality of people that I met finally gave me the sense of having a tribe. And I feel that's very important. As human beings, you need to be supported, loved, respected, all of these words, because that will actually allow you to be the best person you can be. So when I found my tribe, it gave me the guts to say, okay, maybe I do need to reevaluate this. And then I was doing something called Volunteers in Medicine Southern Nevada, and I was seeing their people, low income clinic, right? Not homeless or anything, but just low income, immigrants, things of that sort, people that fall through the cracks, work at McDonald's part-time, can't get insurance. And I was helping them, and all I did was be a physician. I had somebody that was scribing for me. There was no billing, there's no coding. I was just a doctor and I loved it.
Yeah.
And I was like, well, how the hell can I do this?
Yeah, it gave you a taste
Right?
of what you actually
Yeah.
wanted.
Yeah. How can I do this? And I had a colleague here and I'm pretty active on social media too. And I saw this, DPC docs and I went on, I'm reading people's posts and how their quality of life is so much better and this and that and the other. And so I Googled it. Does anyone do it here? And I found a colleague that does. He actually moved to Utah. Boo. But anyway, he was doing it. I was incredulous. So I shadowed him. He's my mentor. He helped me. He got me all set up. He helped me with, all the things because he'd already done it.
Yeah.
So he literally just kind of allowed me to follow in his shoes. And the thing about direct primary care, you can also make it into what you want it to be. So mine is really about prevention. So because I'm also Iranian, I bring a lot of Eastern medicine into things. I've got, experience with homeopathy, with Ayurveda, different parts too. So my practice is about integrative medicine, I think, where I try to bring as much of the Eastern medicine of prevention, but then I have the Western medicine of healing and chronic disease management that I can rely on as well. So that's how I practice. A lot of others might just do, the chronic disease management portion. Some people do aesthetics and Botox and all these things. So that was the best part of it, is that you can make it into what you want it to be. No, I don't think any primary DPC is the same as another. So
were you even allowed to bring that stuff in when you
no.
were? Yeah, okay.
What? In what amount of time, ma'am? By the time I sit there, by the time I finally get the chart of somebody who I have no idea who they are, honest to God, and don't blame us, we've got 1,000
Yeah,
people waiting
no,
for us.
yeah.
We've got 1,000 people waiting for us. I don't know you from John or Mary or, anyone else, unfortunately. Did I want that? No. That's the system that we have, the sick care system. So I get to look at this chart like 5 minutes before I go in, figure out everything that's been done by the last clinician, because I probably have never seen you and you get to see a whole new face. The continuity issue is a huge problem. People have to realize you have to be seen by the same person, because that continuity allows me to help you heal. If I know who you are, if I know what you're eating, if I know your relationships, and I know your damn dog's name, you're going to listen to me. You're going to trust me. You're going to respect me. And likewise, I know that you're going to listen to me. I don't have to worry about you taking your medication so your numbers are off, because I will text you.
Yeah. Do you have like in your head, or have you figured out like how many people you can manage at a time?
Yeah. So like I said, for me, because I'm in a different part of my life, I'm, very blessed and grateful. I'm comfortable doing between 200 to 300, where I still have
Oh,
this
wow.
connection of, oh yeah, I mean,
That's still okay. Yeah.
1,000.
Yeah, it's
My
like nothing.
colleagues, and it's sad to say, right? But
Yeah.
my colleagues, I think a lot of them, because they have, they're a little bit younger, they have families and all this stuff. They carry about 500 to 600 is their comfort.
Yeah.
I don't think anybody's comfort is 1,000, 1,500. I think that's actually gone up to 2,000 now, because there's less of us.
Yeah.
So these numbers get skewed, and the corporate model doesn't care.
No.
They have care. I mean, it's supposed to be healthcare, but it's not. It's not even sick care. It's sick. I don't care. It's
Do you see a way out of it?
A lot. I just told you.
Yeah. I mean,
I just
that
told you the
requires a
ways
lot
that
of doctors to take the initiative like you. And do you think that that's
only if we teach each other,
yeah.
only if we take each other under each other's wings, and we catch people in the medical schools and the residencies, and let them know that they have options. Even my practice right now, people are still incredulous because they don't think this is an option, and it is. But because I don't have that kind of wicked money laying around to advertise and to be on your TV all the time, a lot of my practice is word of mouth. And people, I mean, I have Google reviews that you can read. People are just
Oh, I have friends
still,
that
yeah,
yeah.
yeah, that are
Leadership
still,
friends.
yeah, exactly. So, that's the thing, is that I would like for more of us to come into it, because we can actually practice our art. We can actually be the people that we can be to heal our country? Why are we the worst in healthcare in this world and have all of the infrastructure and the IT and the money and everything? There is zero reason for it.
Yeah.
Zero reason for it other than what I just told you.
Yeah. Yeah. It's
So,
huge.
and the problem is that the doctors, we physicians have to take some of the blame because we kind of thought that we're not business people, so we'll let the business people take over. But then they took over everything. When they're telling us what I can't order, why am I ordering an x-ray on everybody and exposing them to radiation for no reason?
Right.
Why am I giving you medications that were from 1920 when we have the new stuff? Why won't you cover it? That's the whole point of research, is to give you the best and the one, the quality stuff that doesn't have the side effect and getting you the better stuff. Why am I fighting
Yeah.
my time to pre-authorize or give this people a reason, and the people that are in the background are less qualified than I am. I am asking someone less qualified than
Yeah.
I am for an authorization.
Wild.
That doesn't make sense.
No.
So your question about any other countries doing it right,
Yeah.
everyone else is except for
Yeah.
us. So that whole socialized system, it's not going to work here. The
No.
reason being is $350,000 worth of debt as a primary.
Yeah.
Neurosurgeons, orthopedists, things like that, they're not going to get paid the same as I am. They will refuse that. Our healthcare secure system is completely politicized. It won't work. And if you want the government to take over your healthcare, good luck. You're not going to have choice. I won't be around. People like me won't be around for you because we won't be a choice. If you're going to be dictated who you can and can't see, folks, come on.
Yeah.
We didn't do a very good job with
No.
other things, with Medicare and all of that, Medicaid. We haven't done a very good job. So if you all want to come on to that together, good luck. This might be a time for me to retire. I'm okay. I'm in my 50s. So, it's just the kids that are coming on that I'm kind of worried about. We're not going to be able to let them practice what they need to do. Socialized system will never work for our country. Does it work for other countries?
Yeah.
Because they're used to it. But it's not 100% foolproof either. But our system is really daunting in terms of physicians. Okay, so the other problem that we have in this country is we have equivocated physicians with other clinicians, especially in the primary care world. And if you think that my 14 years is comparable to someone with 4 to 2 years of experience.
Yeah.
Okay, so no disrespect to anyone else, right?
No.
I chose to go to medical school. You chose to go to the other schools, right?
Right.
So if you want to give yourself a title, then you have to be ready to uphold by it. So there are individuals now that do call themselves doctors. So the first thing I tell my people, ask them if they went to medical school.
Yep.
Stop right there. Medical school. You can be a doctor and have a PhD, right? Absolutely okay. You could be a doctor and went to dental school or pharmacy school. Actually, attorneys are doctors. They have a law degree, right? That they're doctors of jurisdiction. They have a JD.
My doctor told me that he's like, now people can go for a weekend.
That's right.
To learn about integrated medicine or whatever, and then they call themselves a doctor. And I was like, holy shit.
Yeah. Well, and then we have people that call themselves doctors that have a nursing license.
Oh. Huh.
Okay. So like I said, bring me back. That's a whole nother that's a whole nother world about who is your doctor. You could do a whole nother thing on that. But whose fault is that again? The system.
Yeah.
There wasn't enough of us, right? So they're like, well, this one's just as good. Good enough. That started in the VA, by the way. Another story.
Yeah.
Not good enough. Training matters. Are you going to let the flight attendant fly the plane?
Yeah, no.
Right.
had a question that you gave me, how your travels impacted your views on
Mm,
life. Can you talk
mm.
about that?
Yeah, of course. So one of my biggest passions is traveling the world. That's another thing that I'd like to do before I leave it. Um, and you asked me if I always want to be a doctor. Yes, I have, but I've always had a big affinity for cultures, languages, things like that. So I only got up to three, maybe a little bit of the fourth, but that's kind of like the biggest passion that I have is just seeing this world and appreciating all the different cultures and ethnicities and languages and foods and all of that. So I turn around and I bring that into my practice too, right? Like when I went to Bali, I learned all of the benefits of different teas. Like I said, I'm Iranian, so I know a little bit of benefits of different herbs. I did classes with Deepak Chopra, so I know about Ayurveda and the different doshas, how important it is to inundate your senses, right?
Yeah.
So yes, that is integrative, functional, titles and titles and titles, whatever you want to call it,
Yeah.
great. But family docs, we are the pillars. So we can actually bring different practices of different cultures into our healing as well if we had more than damn 10 minutes.
Yeah.
So that's kind of what I've found from my travels. And now I can bring that stuff back into my practice and kind of enrich my people about, different options that we can try and things like that too. Um,
Mhm.
but also learning how important our spiritual health is,
Mhm.
right? So every other culture in this world we're just getting there. We're just getting there, right? It's kind of like trendy and cool.
Yep.
It's baseline for the rest of the world,
Yep.
right? It's baseline. So our spiritual health, especially in this country, is so broken
Mhm.
that it's 110% affecting mental, physical, all of this other
Yep.
things, diseases, the way we eat, the stuff we eat, the way our foods are even processed in this country,
Yes.
right? So I think California is the first country that's trying to remove all the toxic
Yep.
dyes and things like that that are allowed only in our country. So it's almost like we're trying to kill ourselves, which is hard to see because you go elsewhere and
So
they
different.
don't have that. They don't have soda machines. They don't
Mhm.
have all you can whatever and all
Yep.
you can gorge and you know, um, it's more expensive to buy a can of soda than it is a glass of wine,
Yep.
right? So, and everybody walks.
Yep.
Everybody walks. Well, I don't get it. They eat a whole pizza and they're also skinny because they walk everywhere.
Right. Right.
You
Exactly.
know, and then that's just part of the cultures. I mean, I've seen 70-year-olds on cobblestones on hills with like a grocery bag, and I'm like, that would never happen in the US.
No, and
I
they grow
don't
and raise their own food, like, there's just so much in that, and their communities are so more engaged, it's
Yeah.
so
I
different.
mean, we went to, I think, I did a medical mission in Dominican Republic, right? And
Uh-huh.
so the culture there is also all about family. So when the women would have babies, they would even nurse each other's babies. They would
Read
just,
that.
they all just came together. I mean, at no time did the mother feel alone because it
Yep.
wasn't just her immediate family. It was an entire, once again, tribe
Yep.
that comes together to nurture and take care of each other. So, Kelly, they didn't have stuff and things. They had each other. And
Yep.
that's my biggest take home from my travels and even my own, culture is my dad passed away recently
I'm sorry.
and he couldn't take any of it with him.
No.
And I would give it all back
Yeah.
if he was here. It's not what it's about. It's about this.
Mhm.
So I try to remind my people that too. It's like, why are you like working? One young lady the other day, she's only 30 something. She works 10 hours a day. For what?
I know. I have those conversations all the time, and it's such a difficult habit to unwind and
Yeah.
mindset to unwind, and I'm sure you're having those conversations daily.
Yeah. But I'm in a different place in my life too. So when we were younger and our parents would say, listen to me, I told you so, that kind of nonsense. I feel like I'm there now because, my people are my family,
Yeah,
honestly. I feel like they're my family, especially my younger people. So I feel very blessed to catch them when they're really young like that, because that's when I can actually make a difference, teach them.
yeah,
But it's hard to convince them that we need to do this now. You
yeah,
need to learn now, because if we get caught up later, that's when disease starts happening. Stress is real. What do you think stress is? Stress is real. Stress is to the point that it's so real, it elevates your insulin, it elevates your cortisol, it makes you anxious, it makes you depressed, it makes you fat, it makes you all of these things, right?
yeah,
But then what does it also do? It changes your cells. What happens when our cells change is we start using these ugly words: pre-cancer, cancer, OMA, this or that, itises, pancreatitis, rheumatoid arthritis, colitis, all these itises. A lot of that stuff comes from not only our foods and everything, but our relationships, our environment,
yeah.
everything. So it sounds, sometimes, what is it? Yoo-hoo, woo-hoo kind of stuff,
But
but
it's not, it's real. It's so
it's
real.
real.
I mean,
Yeah.
we've all experienced it,
Yeah.
right?
Yeah, for
Shows up
sure.
in our body.
But the opposite of that is when you do nurture your spiritual healing,
Mhm.
miracles happen. I've seen that
Yeah, I'm sure.
all day. I've seen it. I
Yeah,
can't explain it to you on this side. The science, the Western medicine, the evidence-based. Why did that happen, doc? But this side will tell you it could happen.
yeah,
And it does happen.
yeah. I love it.
Yeah.
Ati,
Hmm.
I
Really?
I'm so grateful that you took that risk and started your own
Yeah, me too.
business so that you can serve people in such a beautiful way. Um, are you doing it only in Vegas or do you okay, so it's strictly Vegas. So everybody listening that lives in Vegas, check out Ati. We'll put links to all of your stuff in the show notes.
So the caveat to that is I can help people as well with telemedicine if they come out here at least once a year to get to get a physical,
Okay.
because I have to put hands on them at some
Yep.
point.
Yep.
So I do have a couple of people out of state. And I think they might have started, but then they left and they didn't want to lose me. So
Yep.
that's one of the guidelines, is that I have to put hands on them in the state at some point too.
Yeah. I love it. It's certainly a gigantic she doesn't settle moment. And I'm excited to see where you go. I mean, I
Thank
know
you.
that you're, at the latter part of your career, but I imagine you have some goals with your business prior to, retiring. Um,
Yeah.
yeah.
Um, I think some of the goals is what we discussed: getting this
Um,
word out, getting it out to our younger doctors that this is an option, getting it out to people in general who feel like they are not heard, feeling like they are not respected, feeling like they can't afford it. All of these words, find us. There is actually DPCs all over the country. There is
I'm
a
gonna ask you.
map called DPC Mapper. You could
Okay.
put in your zip code, you can go on there. And DPC stands for direct primary care. So the only other thing, Kelly, really quickly, is concierge and direct primary care are different concepts. Concierge is a double dip. They take your money, a lot of it, probably, between $3,000 to $5,000 up front for access. But then they still dip into your insurance, right? So it's a
Oh,
double dip. Direct primary care, we do not. We want to have to do as little as possible with your insurance. It doesn't mean we don't take insurance. We don't take insurance for our fees, right? So if you have insurance that plays nice, rarely happens. They play nice, we can order things through them, right? We
yeah.
can still order your labs, your medications, your imaging, whatever, if they play nice. We just have a way to do it better, cheaper, faster. So
Yeah.
it's transparent, it's quality, it's affordable.
Yeah. I love that. Thank you for making that distinction because I think that it can be confusing.
Yeah.
Um, we'll put that DC mapper in the show notes. let everybody know where they can find you to learn more.
Sure. So my website is www.vegasdpc.com. I am on Facebook under Vegas Direct Primary Care. I am on Instagram, and that's hashtag Vegas Direct Primary Care. I am 51, so please give me a break. I do the best I can.
You're all over Facebook. I see it all the time.
I do my best. I mean, even that marketing and all those, videos and whatever that are posted on social media, that's all me.
Yeah.
So if you have suggestions, we can even barter. I'm happy to barter. If you have a service you think that would help me, I can help you too. That's not a problem.
Perfect. I love it. Thank you, Ati. It's been so great to hear your story. And again, thank you so much for what you're doing.
I appreciate you. And thank you for allowing me to share my story. I appreciate you so much, Kelly. Thank you.